Chapter 29 is special needs and medically compromised patient. And as always, we'll pronounce, define, and spell the key terms and go over why it's important for the dental assistant's role in carrying the special care patient. We'll talk about stages and the importance of medical history and major medical disorders. So nearly every dental practice cares for patients with special needs. People are living longer and surviving medical disorders that would have resulted in disability or premature death in the past. An estimated 2% of the national population has some type of disabling condition. It includes developmental disabilities, neuromuscular disorders, immunocompromising conditions, cognitive impairment, mental disorders, and traumas. In 1900s, male life expectancy in the United States was about 52 years. In the 1700s, it was about 27 years. So big difference there. Now, the responsibility of the dentist and the dental team to become knowledgeable about and to identify the challenges that face special need patients. Patients who enter your dental practice may be ill, in pain, or physically challenged. Your job will be to use good judgment when working with these patients. The dental team and the patient's medical team must work together to modify dental treatment according to the patient's needs. So your role is to aid the dentist in providing treatment, serving as a source of information to the patient and family, and making the patient more comfortable and reducing anxiety. The aging population is the fastest growing segment of the U.S. population. People age 65 and older make up 13.7% of the population and represent about 1 in every 8 persons in the United States. It is estimated that by 2050, people age 65 and older will make 21% of the U.S. population. Now, the stages aging refers to the irreversible and inevitable changes that occurs with time. Stages of the older population, functionality, independent older adults are better educated and more demanding of health services than in the past and retain more of their natural teeth. Frail older adults are beginning to have multiple health problems, and more of them have fixed and removable prosthesis, which is your partial dentures or your full upper and lower dentures. Dependent older adults have fewer natural teeth and believe that tooth loss is an inevitable part of aging. So they tend to have medical conditions reflected in their oral health. Oral health of the aging population can be faced with special oral health issues. And the goal of the dental team for these patients is to factor this into the treatment planning phase. A person's general health can actually deteriorate because of poor oral health. Along with the medical history, it is essential that a medication profile be completed for each patient. We talked about xerostomia, which is dry mouth, resulting from certain disorders and medications that involve decreased flow of saliva. Periodontal disease is an increasing problem in the older population. The tissues of older patients may be slower to heal. Tooth decay increases in the form of coronal and root caries and recurrent decay around defective restorations. Dark and brittle teeth result from deposition of secondary dentin that have gradually reduced the size of the pulp chamber. Bone resorption results in the loss of the alveolar ridge. And here we have a picture of periodontal conditions. So if you look down on the bottom here, look at the gum, how much it has receded compared to the other teeth. The other teeth look fairly okay, but this one here is pretty bad, okay? So basically more than 50% of older people may be affected by periodontal disease, and most are unaware of it. This here shows root caries of a tooth in an older patient. So right at the gum line, which is the root, there's caries forming. Now, back in the days, they used to do a lot of these type of fillings, which are called buccal gold foil fillings. We try not to do these fillings anymore. Basically, if they have root caries, we fill them in with composite, which is more aesthetically pleasing. Here we have darkened teeth associated with secondary dentin and aging. We really can't do anything about darkened teeth, other than crowning them. But depending on their age, do they really want to crown their teeth? Um, it's totally up to the patient. Bone resorption with loss of teeth and alveolar ridge. So here they're showing you where the bone has dipped down, okay? And also there's some gum issues going on. It looks like this patient had crowns on these teeth at one point and possibly have lost them because the teeth look like they've been prepped. But when they have these type of issues, usually crowns at this point, will it be a good option for them? We won't know until we actually see the patient's condition and also medical history, which we'll be talking about. The special needs patients providing dental care to patients with a physical or medical disorder will require an increased awareness, attention, and possibly a modification of clinical care by the dentist and dental staff. Once the health and medical history has been obtained from the patient, this information must be used effectively. Each patient history also can help in an emergency. Usually, an emergency will be due to a pre-existing condition. An easy technique is to categorize each patient according to how treatment is anticipated to proceed. For instance, category 1 is your healthy patients. 2, medical conditions requiring scheduling changes or shorter appointments. 3, medical conditions requiring significant modifications in dental treatment planning. 4, medical conditions requiring major modifications, including dental treatment within the operating room. 5, serious medical conditions, only limited care. So, what does it mean by medically compromised? It means that they have systemic medical conditions that can affect oral health and dental treatment. Understanding how a disorder can affect a person's oral health is important to prevent tooth loss or other complications. Symptoms of more than 100 diseases can indirectly affect a patient by causing a person to be less capable of caring for his or her mouth. Specific medical and physical disorders are categorized to help you learn and understand the disease and how to care for that specific patient in your practice. Developmental disorders is the result of an impairment that occurred during the developmental phase, which is the prenatal through age 18 of a person. This impairment can occur prenatally during birth or postnatally. Many of the patients have developmental disorders and are routinely seen in a pediatric dental office. Intellectual disability, the impairment in intellectual and adaptive functioning. The cause is not always known. Rarely a single cause is identified. Some of the known causes are chromosomal abnormalities, prenatal conditions like your rubella, alcohol use, and drug use, perinatal anoxia, postnatal meningitis, encephalitis, trauma, cultural deprivation, severe malnutrition. There are many levels of intellectual disability. It is important to understand each patient's level of communication. Down syndrome, also probably the most common developmental disorder. The overall incidence of Down syndrome is 1 to 700 live births. The incidence increases with the age of the mother. The typical facial appearance includes slanted eyes, a broad flat nose, and a short stature. This disorder also brings about multiple medical conditions that need to be considered in treating the patient. Autism affects how formation is processed in the brain by altering how nerve cells and their synapses connect and organize. Signs of this disorder begin before a child is 3 years old, and the disorder is characterized by inability to get along with people, poor social skills, lack of interpersonal relationships, and abnormal speech and language. Physical disorders. The patient who's physically challenged must adapt to a very fast-paced and mobile world. Patient may need more time for the appointment, and the dental unit may have to be arranged differently for the patient in a wheelchair, vision impaired, hearing impaired. The patient in a wheelchair, accessibility is necessary to provide dental care to individuals with physical disabilities. Specific considerations when an office is designed for all patients include the following: walkways, sidewalks, parking facilities, entrance ramps, handrails, hallways, elevators, the door width, the door pressure or ease of opening, adequate space around door to floor surfaces, carpets and rugs, restroom facilities, reception room design, furniture style, and lighting, operatory design to allow for wheelchair transfer or in wheelchair treatment. So a lot of different things have to be done. Vision impairment varies from total blindness to limitations in color perception, distant perception, recognition of shapes and size of visual field. The vision impaired patient has learned to rely on the sense of touch and oral communication. For the person who cannot see his or her surroundings, all procedures should be thoroughly explained first. And of course, for the visually impaired, you would have to help them with a lot of things, okay? So when guiding visually impaired patients, offer your arm and let them hold your arm. Do not push them. Describe obstacle as you guide the patient. If a guide dog is being used, do not pet or interfere with the dog. Ask the patient first how to handle the dog. And if they need any forms filled out, you would have to help them fill out the forms and then kind of point if they have to do their type of signature. Now, hearing impairment. The patient who's hearing impaired should be treated with extra care and courtesy. Hearing impaired patients may show no visible evidence of hearing loss and may not respond or may respond inappropriately. Clinical considerations for them is remove extra such as suction and music when communicating. Remove your mask when speaking to expose your lips. Use mirrors, drawings, and written information to supplement communication. Keep directions simple and provide written copies for the patient to take home. And a sign language interpreter can be very valuable. You know, with many of these type of patients, whether it's the hearing or the blind or the visually impaired, even some of the Downs and other, they usually come with someone. And so you want to make sure you communicate with their caregiver and with them, okay? Neurologic disorders, they deal with the nervous system beginning in the brain, cover all categories of diseases involving the central, peripheral, and autonomic nervous system, which include the coverings, blood vessels, and tissues such as muscle. Alzheimer's disease, a disorder that begins in middle age and is marked by deterioration of mental capacity, also known as dementia. The patient starts by showing loss of memory and impairment of judgment, comprehension, and intellect. Anxiety, depression, and emotional disturbances can occur as well. Over time, the person becomes totally dependent and unable to perform activities of daily living without help. Clinical considerations is complete a thorough dental exam in the early stages of the disease, pay special attention to prevention, regular oral hygiene, the use of fluoride supplements, and salivary substitutes are important in preserving dental health. In the advanced stages of the disease, many patients cannot tolerate dentures. Patients may show signs of dry mouth caused by a prescribed psychoactive drug. Dental visits scheduled within awareness of the patient's best time of day, and the presence of a family caregiver often allays the patient's fears. Now, seizures. A symptom of brain damage that causes an abnormal electrical brain activity, which can manifest in several ways. Patients who have a severe disorder may be receiving anti-epileptic medications such as Dilantin, which may cause increased bleeding tendencies, drowsiness, lack of coordination, drug-induced gingival overgrowth, and dry mouth. Epilepsy can affect up to 1% of the general population. In about half of the patients, no cause is found. You have your petit mal seizures. This type of seizure lasts no longer than 30 seconds, usually 5 to 10 seconds. And your grand mal seizures have many causes and arise in people in all age groups. They may be preceded by an oral or by localized spasm or twitching of muscles, followed by loss of consciousness. Clinical considerations. Be aware of trigger factors. Having awareness of the presence of an aura sedation may help to prevent a seizure during a stressful dental visit. Staff should be prepared to handle an emergency. Severe cases may require treatment under general anesthesia. Maintain oral hygiene. Before any treatment, question patients with a history of seizures about 1, skipping medications or meal, 2, stress and fatigue, 3, pain, and 4, alcohol consumption. As I continue, does anybody have any questions? And don't forget, you can always stop me as I'm going along. So we're going to describe the major medical disorders. Multiple sclerosis, one of the most common neurologic disorders that affect adults between the age of 30 and 50. As the disorder advances, the patient experiences progressive weakening of the lower extremities, causing muscle weakness, unsteady gait, and paralysis. Adrenal suppressants such as prednisone and muscle relaxants such as diazepam may be prescribed to control muscle spasms. We want to make shorter appointments, may have to be transferred from wheelchair to dental chair. Difficulty in localizing intraoral pain and discomfort. Some patients develop trigeminal neuralgia, development of respiratory problems due to disease effect on the muscles that control breathing. A rubber dam may be useful only if the patient can breathe through his or her nose. Do not position the patient in a supine position to protect airway. 45 degrees is better. Sedation may be required prior to treatment. So those are all the clinical considerations. Cerebral vascular accident, a minor to severe loss of the central nervous system function caused by a sudden vascular lesion of the brain. The patient may have unilateral weakness or paralysis of the eyes and facial muscles, as well as slurring or loss of speech. Clinical considerations for patients with a history of stroke. Schedule for the mid-morning with an average of 10 minutes added to the appointment for additional communication and explanation of instructions. Modified oral hygiene aids may have to be introduced. Neuromuscular disorders affect the nerves that control voluntary muscles, the ones you can control. Nerve cells send the messages that control these muscles. When the neurons become unhealthy or die, communication between the nervous system, and as a result, muscles weaken and waste away. The weakness can lead to twitching, cramps, aches and pains, movement problems. Clinical considerations, patients require shorter appointments. A patient may have to be transferred from wheelchair to dental chair. A dental dam, do not place the patient in a supine position. Nitrous oxide sedation and general anesthesia should be avoided with these patients because of their impaired pulmonary breathing function. So basically, these clinical considerations were pretty much like the ones from before. Muscular dystrophy, it's a group of diseases characterized by progressive atrophy and weakness of the skeletal muscles with increasing disability and deformity. The muscle fibers degenerate and are replaced by fatty and fibrous tissue. This disease is eventually fatal due to the onset of infectious and respiratory diseases and pulmonary dysfunction. Parkinson's disease is a motor system disorder that is the result of the loss of dopamine producing brain cells. The four primary symptoms of PD are tremor or trembling in the hands, arms, legs, jaw, and face, rigidity or stiffness of the limbs and trunk, slowness of movement, and impaired balance and coordination. As these symptoms become more pronounced, patients may have difficulty walking, talking, or completing other simple tasks. Cerebral palsy, group of non-progressive neuromuscular disorders caused by brain damage, usually resulting from anoxia. Amyotrophic lateral sclerosis, and this is commonly referred to as Lou Gehrig's disease. It's a degenerative nervous system disease that causes loss of motor neurons in the cerebral cortex, loss of motor neurons in the cortex, brainstem, and spinal, resulting in muscular atrophy, weakness, and spasticity. This disease is progressive, with patient survival being 3 to 5 years or less. The etiology is unknown, and there is no known cure. Lou Gehrig, if you don't know why this disease was named after him, he was a famous baseball player. And when he became too ill to play, he retired. In his retirement speech, he talked about how he was the luckiest man alive to have had the chance to play. And so the disease was named after him because they didn't even know about it. Since he was famous, the disease kind of became open and famous along with him. Arthritis. Older persons are likely to have chronic progressive arthritis with stiffening of joints. This disorder causes the joints to become inflamed and painful. Physicians prescribe aspirin and corticosteroids to reduce the symptoms of arthritis. And clinical considerations, again, we'll schedule them in the morning and keep appointments short. Now, this disease can limit the patient's ability to hold and use a toothbrush, so we might recommend other things for them to use. There's toothbrushes that have like big handles that, they can use. Arthritis of the jaw joints limits the patient's ability to open the mouth or chew comfortably. And the most common are the rheumatoid arthritis and the osteoarthritis. And the osteoarthritis happens when the protective cartilage over the ends of the bones wear away and bone rubs on bone. And the rheumatoid arthritis is an autoimmune disorder in which the body recognizes its own tissue as foreign and makes antibodies to attack what it thinks is an invader. Then you have your cardiovascular disorders. Heart disease continues to be one of the most serious threats to the health of an individual. It is the leading cause of death among men over the age of 40 and among women over the age of 65. It can manifest in many ways, such as hypertension, stable or unstable angina, congestive heart failure, and myocardial infarction. That myocardial infarction means heart attack. Clinical considerations: avoid stressful, lengthy appointments, assess vital signs before treatment, consider monitoring throughout the procedure. The dentist may use psychotropic pre-medication and nitrous oxide to help relieve stress. Consider using supplemental oxygen during procedure. The dentist may consider the use of prophylactic sublingual nitroglycerin immediately before treatment. So that's like a little pill that they give them to put under their tongue, sublingual. Epinephrine and other vasoconstrictors can be administered within limits to patients with mild to moderate cardiovascular disease. So that means that we cannot give a lot of anesthetic. Okay, we have to make sure we limit it. And seated patients are more comfortable in a semi-supine rather than a supine position. Now, there is always a chance that a patient is having a heart attack and not an angina attack. If the pain is unrelieved following 3 doses of nitroglycerin, it is assumed the patient is having a heart attack. Congestive heart failure, a condition in which the heart cannot pump enough blood to the body's other organs. This lack of circulation throughout the body can result from narrow arteries, scar tissue from a past heart attack that interferes with function of the heart muscle, high blood pressure, heart valve disease, heart defect, and infection of the heart valve or muscle, endocarditis or myocarditis. Hypertension, high blood pressure, the result of the heart having to work harder as it pumps against resistance such as that provided by a blocked artery. And the major factors are stress, age, heredity, smoking, and obesity. Angina, a decrease in blood supply to the heart muscles causes a sharp pain in the chest. Patients in whom angina has been diagnosed usually have also been given a diagnosis of coronary atherosclerotic heart disease. Angina is a sign that the patient is at risk for a heart attack. Stable angina, it means that the pain is usually predictable. In unstable angina, the pain is unpredictable. And again, if someone's having an angina attack, we usually use nitroglycerin tablets or spray. Endocarditis, cardiac disease, and or prosthetic replacement convey an increased risk for bacteria to be carried in the blood system. A severe infection of the cardiac valves and supporting structures caused by bloodborne pathogens that gain entry to the bloodstream from such places as the mouth and gastrointestinal tract. Pulmonary disorders, disorders that affect the lungs and are characterized by airway obstruction. Patients can be diagnosed with a pulmonary disorder with symptoms from several disease categories. Allergies, a condition in which the body reacts to an antigen. Most reactions can be managed by having the patient take an over-the-counter medication or a prescribed medication that reduces the symptoms of the allergy. If the reaction goes beyond this type of management, the allergy becomes a life-threatening emergency. And clinical considerations, complete a thorough medical history to determine specific allergens. Pay special attention to the latex and dental material use. The good thing is that nowadays in the dental office, a lot of our gloves and other stuff that we use is latex free. So that has limited the allergies. And of course, have epinephrine stick available for possible emergency. Bronchial asthma is a chronic lung disease that inflames and narrows the airways, causes recurring periods of wheezing, chest tightness, shortness of breath, and coughing. Bronchial asthma often arises from allergies and is characterized by an increased hypersensitivity to various stimuli, resulting in bronchial edema and widespread narrowing of the bronchial airways. And right now, more than 22 million people are known to have asthma in the United States. Clinical considerations, every effort should be made to minimize stress. It is best to shorten appointments and to use sedation. And the use of epinephrine and aspirin should be minimized. Now, your COPD, which is your chronic obstructive pulmonary disease, is characterized by blocked airflow during respiration. Chronic bronchitis is a disorder that results in irreversible narrowing of the bronchial airways caused by chronic inflammation, increased production of mucus, edema of the bronchial mucosa, and reduced ciliary activity. Emphysema is the irreversible enlargement of the size of the air spaces that results in labored breathing and an increased susceptibility to infection. And the clinical considerations, again, minimize stress, short appointments, schedule them in the morning, use sedation techniques in low risk to moderate risk patients. Consider using a humidified oxygen given by nasal cannula. Avoid the use of nitrous. Do not treat patients in a fully reclined chair. Avoid any anticholinergic drugs which dry bronchial secretions, and do not schedule elective treatment during hot and humid weather. Blood disorders can involve cellular elements of the body, anemia, leukemia, which is an excessive increase in the number of white blood cells may indicate infection or leukemia. Hemophilia, excessive bleeding caused by a congenital lack of a protein substance necessary for blood clotting, can occur in hemophilia. And antibiotic prophylaxis may need to be prescribed for high-risk procedures. So if any patient comes to the office and they're a high risk, the doctor will give them some antibiotics to take possibly an hour before their appointment. Otherwise, it may need to be rescheduled. Now, clinical considerations for blood disorders. The important factor for patients with a blood disorder is their susceptibility to bacterial infection. And that's why I mentioned the antibiotics. Treatment modifications have to be made for any surgical procedure. And again, antibiotics prophylaxis may be prescribed. Endocrine disorders. Glands located in many different regions of the body release hormones into the bloodstream. The thyroid gland regulates metabolism in body cells and stimulates passage of calcium into bones from the blood. Hypothyroidism, a patient with an overactive thyroid gland has Graves' disease. Hypothyroidism, when the thyroid gland is underactive and produces fewer hormones than usual. And clinical considerations, an accurate and current medical history and medical consultation are essential. Hyperthyroid patients who are not being treated are highly sensitive to epinephrine and other amine anesthetics. Diabetes mellitus. It's a disease characterized by a sustained high blood glucose level resulting from an absolute or relative lack of insulin. And clinical considerations, minimize stress, short appointments, schedule them in the morning, use sedation techniques such as administration of nitrous oxide or oral diazepam. Instruct patients to maintain normal dietary intake for dental appointments. So it's really important for the diabetes patients to eat and minimize the risk for infection. Normally in the office, to help them, we might have some orange juice, sugar candy, sugar packets, things like that. Now, behavioral and psychotic disorders, biologic, genetic, psychological, and social components can contribute to many types of behavioral and mental disorders. Psychiatric disorders can affect the treatment of dental patients because of the drugs prescribed, which influence the function of the brain. Anxiety is a feeling that all is not well. Depression is a condition of general emotion, rejection, and withdrawal. Eating disorders are present when a person experiences severe disturbances in eating behavior. Anorexia nervosa, binge eating disorder, or bulimia nervosa. Bipolar disorder is characterized by extreme elation followed by depression. Substance abuse can affect all aspects of life. Post-traumatic stress disorder is re-experiencing a traumatic event. And schizophrenia is a psychotic disorder characterized by varying degrees of personality disorganization. And clinical considerations, we have to understand that dry mouth may result from the psychoactive drugs prescribed, regular hygiene and the use of fluoride supplements, and any salivary substitutes are important for preserving dental health. Patient cooperation and informed consent may cause problems, particularly in the patients with dementia. Do we have any questions?
No.
No? Well, I want to thank you, ladies,